Good evening, everybody. I'm Sayukta from Beautiful Spotless Skin Team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of human right from the beginning of civilization. Few of the very common condition affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne. To many, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence. According to a recent data, almost 80% of people in the age group of 11 to 30 years have acne outbreak at least once. Although acne most commonly does not have any serious health concern, but is de-stressing for the sufferer. The faster the issue is resolved, the more effective will be its treatment. So diagnosis is really important. Thus, knowing about acne management from an expert is essential. And for this, today we have a very young and dynamic consultant dermatologist, Dr. Swati Surabhi from Patna. She is a gold medalist MD from Patna Medical College and Hospital. She is consultant at Waater Hair and Cosmetology Clinic, Patna. Today, Dr. Swati Surabhi will talk on acne management. A very warm welcome to you, Dr. Swati. Hope you're doing good, ma'am.
Thank you so much, Sayukta, for inviting me over. And hello, everyone.
So, Dr. Swati, as you know, today we are going to talk about acne management. So, first of all, we would like to understand what is acne.
As you already mentioned, acne is a very common skin disorder. So what is acne? Basically, it is a chronic inflammatory disease or disorder affecting the pilosebaceous glands, which are mainly present over our face and trunk region. So there are certain causative factors, or we can also say triggering factors, which lead to development of acne. So these include stress, certain environmental factors, hormonal imbalance, and a few cases are also associated with genetic predisposition. Then there are certain medications which also lead to development of acne lesion, and there are certain cosmetic products which also lead to acne lesions.
Right. And talking about weather and the relationship or correlation of weather with acne, we would like to understand, does acne is specific to any season or occurs throughout a year? Because many a times, people will say that
Am I audible?
Doctor?
Yeah.
Yes.
Am I audible?
Yes, absolutely audible. And as we are talking about the correlation of acne and weather change, because many a times people do complain that they get acne breakouts when there is a weather change or when winter is approaching and or when there is, monsoon, etc. Please elaborate on that a bit.
So, well, acne is a disease which can occur all through the year, but there are certain people who, complain of summer exacerbation. So, what happens in summer? There is increased sweating, there is increased sebum production, there is humidity. So, all these lead to clogging of the pores and exacerbation of the acne lesion. And this problem is usually faced in countries like our country, like tropical areas. However, in Western world, what we see that there is resolution of the lesions in summer and there is winter exacerbation. So in our part, many patients they complain of summer exacerbation, but not all.
Right. And when we talk about, acne breakouts, we would also like to understand, is there any way to prevent acne breakouts? Because most of the time we say, that prevention is always better than cure. So any way to prevent acne?
Yeah, so hygiene is the most important thing. You have to keep your face clean by using, a proper cleanser or face wash based on your skin type. Please do not use cosmetic products, which are comedogenic, which can cause acne lesions. Then apart from these, makeup, heavy makeup, these are also important cause of acne breakouts. So use makeup products which are again non-comedogenic. And
Yes.
after application of the makeup, the removal of makeup is also very important. So properly remove the makeup. And lastly, the various facial procedures which are being done in salon. So those should be avoided. They do nothing beneficial to the skin. Rather, they increase the acne breakouts. So these are certain points which, if
Right.
kept in mind, then acne breakouts can be prevented.
And doctor, before we move forward, can you shift your screen setting to vertical?
Okay, yeah.
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 Thank you.
Is it?
Perfect. Yes, it is fine. And doctor, most of the time we say, and as I have already said in the introduction part as well, that it's during puberty or adolescence that a person goes through these acne breakouts the most. But then there's also a term called adult onset acne. We would like to know a bit about that as well.
Yes. So conventionally, acne was thought to be a disease of teenagers or adolescent age group.
Right.
But now we have seen that acne can occur in extremes of ages also. So infantile and neonatal acne is also there, and then adult acne is also there. So when a person develops inflammatory acne beyond 25 years of age, then such condition is termed as adult acne, which is usually seen in females and is usually associated with hormonal imbalances or premenstrual flares. And one most characteristic finding of adult onset acne or adult acne is that the lesions are mainly present over the jaw area and the perioral region.
राइट कई बार ऐसा होता है कि लोग कहते हैं कि टीनेज में तो कभी एक्ने नहीं हुआ लेकिन नाउ व्हेन वी आर 30 35 और 40 वी आर हैविंग दीज एक्ने ब्रेकआउट्स एंड एज यू सेड फीमेल्स में ज्यादातर होता है अडोलेसेंस या प्यूबर्टी के टाइम पे भी हमने देखा है कि जो टीनेज गर्ल्स होती हैं उनमें एक्ने ब्रेकआउट ज्यादा होता है लेकिन ये तो नहीं कहा जा सकता कि मेन और बॉयज दे जस्ट डोंट सफर फ्रॉम एक्ने ब्रेकआउट्स तो उनके लिए आप क्या कहना चाहेंगे खास तौर पे उन पुरुषों के लिए for those men who have these acne breakouts?
So, men also suffer from acne. But the thing is that females जो होती हैं वो अपने स्किन का थोड़ा ज्यादा केयर करती हैं. But, मेल होते हैं, जो men होते हैं, they usually neglect. So, डेली रूटीन होता है लाइक क्लिनजिंग एंड मॉइस्चराइजिंग एंड जो अभी पॉइंट्स हमने डिस्कस किया अबाउट प्रिवेंटिंग एक्ने ब्रेकआउट. सो इफ दैट इज केप्ट इन माइंड, अगर मेन की भी बात करें बॉयज की भी बात करें तो उनमें भी एक्ने की ब्रेकआउट्स को रेकरेंसेस को प्रिवेंट किया जा सकता है. एंड दूसरी बात, डर्मेटोलॉजिकल कंसल्टेशन इज ऑलवेज रिक्वायर्ड, बी इट गर्ल्स और बॉयज.
Exactly. So the most important part is taking care of your skin and, be concerned about your skin no matter what gender you are. Plus, seeking the advice from a right person, which is a qualified dermatologist in this case. Now, what happens, Dr. Swati? I'm sure you will also agree with me, especially in case of skin. वी कुछ भी हमारी स्किन के ऊपर होता है, कोई भी प्रॉब्लम, वो एक्ने ब्रेकआउट हो, सिस्ट हो, किसी तरह की एलर्जी हो, हम सबसे पहले होम रेमेडी करने की कोशिश करते हैं, दादी नानी के नुस्खे आजमाते हैं, वो फेल हो जाता है, स्पेशली इन द केस ऑफ एक्ने ब्रेकआउट्स, विल गो टू द केमिस्ट एंड आस्क कि केमिस्ट वाले भैया से कि भैया एक क्रीम दे दीजिए, एक्ने हो रहा है, एंड वी ओनली लैंड अप टू द डॉक्टर व्हेन नथिंग इज इन आवर कंट्रोल एनीमोर। जब चीजें बहुत आउट ऑफ कंट्रोल हो जाती हैं, वर्स हो जाती है, तब एक आम इंसान डॉक्टर के पास पहुंचता है। तो आपसे जानना चाहेंगे डॉक्टर स्वाति, होम रेमेडीज, ओवर द काउंटर मेडिकेशन, ये एक्ने की प्रॉब्लम को बढ़ाता है या कम करता है?
कम तो बिल्कुल भी नहीं करता। तो हमारा तो हम लोगों का सबसे पहला एडवाइस पेशेंट्स को या नॉर्मल पीपल को यही रहता है कि प्लीज अवॉइड फॉलोइंग सच होम रेमेडीज ऑन फ्रीक्वेंटली पोस्टेड ऑन सोशल प्लेटफॉर्म्स, एंड प्लीज डू नॉट कुछ भी अगर आपको स्किन में प्रॉब्लम हो रहा है, प्लीज प्लीज डू नॉट यूज द OTC प्रोडक्ट्स विच आर अवेलेबल एट द केमिस्ट शॉप, बिकॉज दे यूजुअली contain steroid preparation. Now what steroid does, it not only worsens your acne, it can also lead to development of acneiform eruption, and it also damages your face. So please don't do that. Always consult a qualified person for your acne.
राइट, इसलिए डर्मेटोलॉजिस्ट के पास जाना बहुत जरूरी है। बट मेनी टाइम्स पीपल विल से कि एक्ने हुआ है, डॉक्टर के पास क्यों नहीं जा रहे हो? तो दे हैव दिस थिंग कि डॉक्टर के पास जाएंगे तो स्टेरॉइड्स देंगे, तो इसलिए हम ऐसे ही ठीक हो जाएंगे। लेकिन ऐसे कैसे हो रहे हैं? हम अननोइंगली हम भी एट द एंड ऑफ द डे केमिस्ट शॉप से स्टेरॉइड्स ही लेकर आ रहे हैं, एंड वी आर अप्लाइंग इट विदाउट इवन नोइंग कि क्या डोसेज होना चाहिए, वो हमारी प्रॉब्लम के लिए वो सही है भी या नहीं। तो जैसा कि हम बार बार कहते हैं कि इट्स इंपॉर्टेंट टू डायग्नोस द प्रॉब्लम, रूट कॉज क्या है ये समझना जरूरी है। क्या एक्ने के ट्रीटमेंट में भी रूट कॉज समझना जरूरी है?
Look, acne है जो एक acne is a multifactorial disease or a disorder. So exact cause पता करना is very difficult for any of us, because as already mentioned, like stress हो सकते हैं कुछ लोगों में, hormonal imbalance हो सकते हैं, genetic predisposition, तो बहुत सारे factors हैं। तो exact factor किसी एक person में पता करना is very difficult, but yeah, depending on the severity, depending on the skin type of patient, we can start the treatment, and it will cure the disease if taken properly.
Fair enough. कुछ सवाल भी हमारे व्यूअर्स के मैं ले लूंगी। हमारे साथ अब्दुल नईम शेख है, पूछ रहे हैं, इज देयर अ प्रॉपर वे टू क्लिंजिंग माय फेस सो आई डोंट गेट एक्ने? एंड इन एडिशन टू दिस क्वेश्चन डॉक्टर, आई वुड आल्सो लाइक टू आस्क यू, मेनी टाइम्स स्पेशली पीपल हु हैव एक्ने प्रोन और ऑयली स्किन टाइप, they'll go on washing their face with a face wash or cleanser as many times as possible, because they have this notion in their head कि अगर हम बार बार वॉश करते रहेंगे तो हमारा स्किन जो है ऑयल फ्री रहेगा एंड दस वो एक्ने फ्री रहेगा। क्या सच है?
Well, cleansing is very important, but it should not be excessive. Anything should not be, excessive. So based in type, like acne prone जो patients होते हैं, they are not only oily, they do not only have oily skin. Even dry skin people, even combination skin people, they also develop acne. So dermatologists say prescribe a proper cleanser you should be using, usually salicylic based or glycolic acid based cleanser, but frequent cleansing is not recommended. At least twice cleansing is sufficient enough.
ओके और इसी तरह से जैसा आपने कहा था कि मॉइस्चराइजर भी जरूरी है, मॉइस्चराइजिंग योर स्किन इज इक्वली इम्पोर्टेंट, यूजिंग और अप्लाइंग अ सनस्क्रीन इज इक्वली इम्पोर्टेंट, बट अगेन in a case of a person who has this oily skin type of or acne prone skin, they'll say कि ऑलरेडी बहुत ऑयल सिक्रीशन होता है तो क्यों मॉइस्चराइजर करें, तो वो मॉइस्चराइज नहीं करते हैं या बोलते हैं कि मॉइस्चराइज करेंगे तो और ज्यादा एक्ने ब्रेकआउट होगा। सनस्क्रीन को लेकर भी एक्ने ब्रेकआउट्स जिनको होते हैं वो आमतौर पर कहते हैं कि ऑलरेडी इतना एक्ने हो रहा है, उस पे हम सनस्क्रीन अप्लाई करेंगे, इट्स ओनली गोइंग टू मेक इट वर्स। तो ये तमाम कंप्लेंट्स, एक्सक्यूजेस जो आमतौर पर लोग देते हैं, व्हाट्स योर टेक ऑन दीज?
Look, moisturizer is a must for people of all skin types, be it dry, oily, or normal. Even oily skin people, this is a myth that oily skin do not need moisturizer. What happens in oily skin, if agar aap bar bar dhote rahoge and if you do not apply moisturizer, a signal is sent to the sebaceous glands, and then there is excessive sebum production. So that will, again worsen the condition. So proper moisturizer and sunscreen both are essential for oily skin people or acne prone people. But the moisturizer or the sunscreen, that should be oil free, that should be non-comedogenic and hypoallergenic. And the sunscreen also should be matte finish and silicone based. So अगर आप dermatologist से prescribed proper sunscreen or moisturizer use करेंगे, you won't have any breakout, and it will even help in improvement of your skin and acne condition.
Okay, doctor, there is one more question from a viewer. The question is, should I stop wearing makeup if I have acne?
As already said, like heavy makeup should be avoided. There are certain, makeup products jahan mentioned rehta that they are non-comedogenic and mineral based. So that you can apply, not a very heavy layer, not a very thick layer. And after application, you have to remove it very properly. This is very important. So makeup you can apply, but you have to be cautious about your products which you are using and how you're removing it afterwards.
Right. Before also you said or emphasized on the need of removing the makeup, which you said is very important, and removing it in the right way. Now, would you like to shed some more light on that, that how to remove the makeup, and especially if we have, those acne breakouts, etc., it becomes a little difficult or painful to, completely remove the makeup from the skin. What should be the right way of doing that, doctor?
You can go for double cleansing, like various makeup removers are there. So you can use the makeup remover firstly with the cotton ball and wipe off your face, and then use the recommended face wash. So double cleansing, that is wiping off and then washing your face with the face wash, is very important. And then proper moisturization.
Right. And before we go to bed, or a person who has this, acne prone skin or oily skin, anything special that they could do to prevent acne breakouts before they go to bed?
This is all, like cleanse your face properly, moisturize your face properly, and then the anti-acne medication which we usually prescribe, that is also usually, it has to be applied during night time. So you have to first apply the moisturizer over your face and then apply the anti-acne medication. So this is all. And yeah, one more thing I would like to add, that oiling of scalp. We usually, advise people with acne or acne breakouts to avoid oiling of, hair. So what happens, that oil, it forms a film over your face and it clogs the pore. So many people have a tendency of oiling their hair during night or, before going to bed. So that should also be avoided.
And many people have this, problem of dandruff, etc., and they also have this tendency of getting a lot of acne. So again, is there a correlation?
Yeah, like dandruff, or we, call it seborrhea. So seborrhea and this acne vulgaris, both are disease which is basically based on excessive sebum production. So yahan, like seborrhea may be, like dandruff maybe, this is due to excessive sebum production over your scalp. And in acne also, there is excessive sebum production in your pilosebaceous glands, which is present over your face. So there a correlation does exist between seborrhea, that is dandruff, and acne.
Right. And doctor, we would now like to discuss about the treatment options available for acne management.
So if we are talking about treatment, so the most important thing is the duration of the treatment. As I've already said, that acne is a chronic disease. So the treatment also needs to be, continued for a specified period of time, like 6 to 8 months is needed. 1 to 2 months is not enough. Then for treatment, we have a topical preparation like cream and gel formulation, like retinoid cream, benzoyl peroxide cream, antimicrobials. And then we have oral medications, which again, includes antimicrobials, retinoids. Apart from these, we also do chemical peeling, that is salicylic acid based chemical peels are done over face, which also hasten the resolution of the lesion and preventing the hyperpigmentation over the face.
Right. और जब एक्ने का ट्रीटमेंट चल रहा होता है, टॉपिकल एप्लीकेशन के लिए क्रीम्स एक्सेट्रा दिए जाते हैं, तब क्या सनस्क्रीन का यूज और ज्यादा इम्पोर्टेंट हो जाता है?
yes absolutely, because जो भी हम एंटी एक्ने मेडिकेशंस प्रिस्क्राइब करते हैं, what they do, they lead to dryness and exfoliation of the skin. So there is little bit thinning of skin, so there are more chances of developing hyperpigmentation. sun exposure होगा, skin thin है तो और pigmentation के chances होते हैं. So sunscreen is must for these मतलब with these anti acne medications.
Okay, I'll take few more questions from our viewers. What lifestyle changes should I make to combat acne?
So lifestyle changes apart from the non-comedogenic products, which I've already said that non-comedogenic moisturizer, non-comedogenic sunscreen, then cleansing is important. Apart from these, certain dietary restriction or dietary modification we advise for people with acne. Then usually if the acne is associated with PCOD or obesity, तो वैसे patients को हम कहते हैं कि थोड़ा सा regular workout or exercise for 15 to 30 minutes will also help. Apart from these, like as I have already said, that avoid oiling, avoid the OTC products.
Right. So these should be avoided, and a healthy lifestyle is definitely what you need to keep your body, in a good shape. And of course, what's going on inside your body will get reflected on your skin, because skin is the mirror of our body. Okay, so Sri Satish is here asking, Doctor, how frequently should I apply moisturizer?
So twice daily application of moisturizer is sufficient enough. But if you have dry skin, or if you are on anti-acne medication, so in that cases also there is excessive dryness. So if you feel you are having dryness, even after twice daily application, you can apply moisturizer as and when needed. There is no harm in applying moisturizer more than twice a day.
Okay. And in case of sunscreen, because again, people say it's important to, reapplication of sunscreen, and the right amount of sunscreen that you are using is equally important. But the thing is that, we have this notion that sunscreen is something which protects our skin from the sun, as the name suggests. So if there is no sun, like winters are approaching, why should I use a sunscreen? Or if I'm working from, my home, or I'm inside the office, I'm hardly exposing myself under the sun. Why should I, use a sunscreen, or why should I reapply sunscreen? Because I've used it once, that's enough. So what's your take on such things?
So first of all, reapplication is very important, because sunscreen once applied, it works only for 2 to 3 hours. So reapplication is very important. And second point is like why we should apply sunscreen at home also. So the sunscreen, they protect us from not only from UV radiation but also from infrared radiation, visible light, even the tube lights and the bulbs which we have at our home, they also emit light. So they also have a harmful impact over our skin. Also, it is not this is not true that if we are stepping outside, then only we are having an exposure of UV rays. UV rays can also reach us through the windows of our houses. Even if there is cloud, even if the winter season is here, we are not feeling the heat, but the UV rays are still reaching us. So application of sunscreen all through the year and wherever you are is very important.
अच्छा, एक और बात जो आमतौर पर लोग खास तौर पर सनस्क्रीन को लेकर कहते हैं, वो ये कि अगर सनस्क्रीन हम अप्लाई करेंगे तो विटामिन डी जो हमारी बॉडी को अब्सॉर्ब करना है सन से, वो ठीक से नहीं हो पाएगा. इज इट अ मिथ? व्हाट्स द ट्रुथ?
Well, sunscreen से obviously UV rays prevent होते हैं, but not to that extent that it will affect the vitamin D synthesis in our body. So that is basically a myth. You can safely apply sunscreen.
Suman Yadav is here asking, should I take any vitamin supplements to beat acne?
Basically you can take zinc preparation, zinc based supplements for acne. Otherwise, anti-acne medications like antimicrobial and retinoids are enough.
Okay. Parul Shinde पूछ रही हैं, is acne also due to hormonal imbalance?
Yes. As I have already, told that adult acne that is usually associated with hormonal imbalance. So if you are having acne apart and along with it, you are having premenstrual flares or menstrual irregularities or excessive hair growth of over your face, then these are certain signs of hormonal association of acne. You should visit an endocrinologist along with a dermatologist for the same.
Okay, so I'm getting this one type of question again and again. So I would again like to pick this question. So this time it is from Ishita Cha. Her question is, do breakouts just mean you don't wash your face enough? और ये वाकई में बहुत सारे लोगों को लगता है कि एक्ने हो रहे हैं मतलब हम अपने स्किन को ठीक से साफ नहीं रख रहे हैं, और साफ से उनका मतलब हाइजीनिक नहीं है, उनका मतलब होता है कि हम उसको बार बार ठीक से धो नहीं रखे। Again, doctor, would you like to shed some more light on that?
Look, cleansing of face is important, but excessive should be avoided. And agar aap like twice daily be face wash off kar rahe hain and still you are developing acne, so this is basically because acne का जो पॉजिटिव फैक्टर्स है वो बहुत सारे हैं. इट इज नॉट जस्ट अबाउट क्लेंजिंग योर फेस. क्लेंजिंग विल हेल्प इन इन योर ट्रीटमेंट, बट आपको एक डर्मेटोलॉजिस्ट से कंसल्ट लेना चाहिए फॉर योर ट्रीटमेंट. रेकरेंट ब्रेकआउट्स अगर हो रहे हैं तो डर्मेटोलॉजिकल कंसल्टेशन नेसेसरी है. इट्स नॉट ओनली अबाउट वॉशिंग योर फेस मल्टीपल टाइम्स एंड you'll be free of acne. This is basically myth.
Right. Most of the time, as we have already discussed before, that what we do when we have any issue over our skin, acne or anything, we will try to fix it at home with some home remedies, or we'll go to the chemist shop, or we'll find out some, quick fixes by some of the influencer online, etc., etc. We end up wasting so much of time, energy, even money, and at the end of the day, we get an even worse, skin condition. So it's always advisable to save your energy, save your money, save your time, go and meet your doctor. Yes, doctor, you would like to add something to that?
No, I completely agree with you.
Okay, so yeah, so the whole purpose of having this session is to make our viewers aware that, see, please don't waste your time, money, energy, don't waste your skin. Just go to the right person, which is a qualified dermatologist. One more question from our viewer. Are there any new technologies or procedures for skin maintenance?
Yeah, chemical peeling and laser therapy are certain new, therapies which are important for skin maintenance. And then we also have PRP, not for acne, platelet-rich plasma therapy for maintenance of skin. So this was not for acne, but for otherwise you can maintain your skin with platelet-rich plasma therapy. There are various laser and light procedures which are being done these days.
राइट डॉक्टर, ये भी बहुत आम है कि अगर हमारे स्किन में एक्ने ब्रेकआउट्स हमको देखने को मिल रहे हैं या एक्ने प्रोन स्किन है, तो एक तो मेडिकेटेड प्रोडक्ट्स होते हैं, राइट, और एक होते हैं जो कॉस्मोलॉजिकली जो मार्केट में अवेलेबल होते हैं. बहुत ज्यादा एडवर्टाइजमेंट और मार्केट के भी कई बार लोग शिकार हो जाते हैं, तो दे एंड अप कीप ऑन बाइंग प्रोडक्ट्स कि अच्छा ये एंटी एक्ने है या इससे मेरे एक्ने ठीक हो जाएंगे, तो ये भी परचेज कर लेते हैं. इन्फ्लुएंसर ने कुछ कहा तो वो भी हम परचेज कर लेंगे. Then there's also this tendency of going to saloons or parlors and going for acne treatments there. क्या वो harmful हो सकता है?
Yeah, absolutely. So like I've already told that these facial therapies which we do in salon, they have a very detrimental effect on our skin, and they can severely affect your skin, can cause frequent acne breakouts. So those should be avoided. Instead, you can go for chemical peeling. That will help in not only resolution of your acne, but also improving the texture, improving the having brightening effect and glowing effect. So instead of these facials, you can go for chemical peeling to a dermatologist.
Okay. One more question from our viewer. Does lack of sleep and stress cause acne?
Yeah, stress is a very important factor, a very important triggering factor for acne. So proper amount of sleep and a stress-free environment is very necessary for resolution of the acne lesions.
Okay. Doctor, is it true that milk or dairy products they aggravate the acne breakouts, or it is just a myth? Please tell us about the same.
Yeah, there have been various studies regarding this, and it has been seen that yes, milk and milk product they are associated with acne flare. So even skimmed milk is also associated with acne flare. So the milk they usually contain certain hormones like androgens, certain bioactive molecules, which lead to as a trigger for inflammatory acne. So milk and milk products should be avoided in persons with acne.
Okay, and apart from milk or dairy products, any other dietary precaution or what kind of diet should we follow during acne breakouts? Anything that we can include or omit from our thali?
Yeah, apart from milk and milk product, patients are discouraged for a low carbohydrate diet. Usually high glycemic index diet has to be avoided. Protein rich diet is encouraged. Then these days whey protein supplement are available for bodybuilding, so these are also associated with flares of acne. So that has also need to be that should be also avoided. And recently association of vitamin B12 with acne flare has also been seen. So if you are using vitamin B12 supplementation, that might also be a cause of your acne flare. So these are certain dietary restrictions. One more thing I would like to add: oily food and food items like chocolates and ice creams and pastries, they should also be restricted.
Exactly. Okay. And Doctor, in last 2.5 years during the pandemic and post-pandemic, we have seen because mask has become like our next skin, our second skin, and we have seen a lot of mask acne happening, a lot of acne coming out of the area which was covered by the mask. Now, how to get rid of that? Because mask is still, again, people are using it, and it's again very important for all of us to keep us safe. How to use a mask then?
So what happens with mask use? There is occlusion of the pilosebaceous gland which are present over our mandibular or the areas around the jaw and the lips. So occlusion leads to excessive sebum production, clogging of the pores, and development of acne. So what we can do is we can use a cotton mask beneath the N95 or the surgical mask we use, and we should frequently wash it. You should always use a clean mask. If you're using the same mask again and again, it will lead to development of acne lesions. Then for treatment, the treatment is line is same as for the normal acne. Mask acne, the treatment line is same.
Okay. And Doctor, one more question from a viewer, though we have already discussed it, but again, because it's a very important thing, the question is, what should be an ideal skin care regimen for acne management? Would you like to share the things with us one more time?
Yeah, definitely. So, if you're having a dry skin, gentle cleanser you should use a gentle cleanser. If you're having an oily skin, salicylic acid based or glycolic acid based face washes should be used. Then, after proper cleansing, you should use a oil-free, non-comedogenic moisturizer based on your skin type. And over the top, you should use a matte finish, silicone-based sunscreen. So, this is the regime you should follow and avoid oiling your scalp.
Okay. And Doctor, acne is one problem, acne scar or acne mark is another. Now, many times people say acne तो ठीक हो जाता है, acne का scar नहीं जाता या बहुत दिक्कत करता है, बहुत मुश्किल हो जाता है. तो सबसे पहले तो acne scar हो ही ना, उसके लिए हम क्या कर सकते हैं और अगर हैं तो क्या करना चाहिए?
Yeah, so better, reach a dermatologist as early as possible. When you start developing acne or you are having recurrent acne, better to consult a dermatologist as early as possible so as to prevent the sequelae. Now, to prevent the scarring and this hyperpigmentation, one advice which we give to patient is like do not touch your face frequently. What people do, they have acne and they touch their face frequently, and they scratch, or they have a habit, some people have a habit of scratching or picking the acne lesions. So these can lead to worsening of the acne as well as severe hypopigmentation and scarring. So this should be avoided. Now if you have developed acne, scarring, and hyperpigmentation, so there are topical medications which you need to do, and chemical peeling are there. But yes, this is a time taking process. It will take time. It is not going to, disappear in 1 to 2 months. Then for scarring, there is, micro needling or derma roller. We have platelet rich plasma therapy. We have laser therapy, fractional CO2. So there are a lot of treatment options for both hypopigmentation and scarring. But I will, advise the better, होने ही ना दें. Go to a dermatologist as early as possible.
एग्जैक्टली और कई बार जैसा आपने कहा हम हाथों से एक्ने को बहुत टच करते हैं, उसे प्रिक करने की कोशिश करते हैं, मोबाइल फोन्स को बिल्कुल अपने चेहरे से सटा के बात करते हैं, वो बहुत गंदे होते हैं, या पिलो केस जो हमारे होते हैं वो रेगुलरली हम चेंज नहीं करते। तो ऐसी बहुत सारी चीजें छोटी छोटी लगती हैं, लेकिन उनका असर जब एक्ने और एक्ने स्कार्स में देखने को मिलता है तब लगता है कि इन छोटी छोटी बातों का ध्यान रखना बहुत जरूरी है। एंड डॉक्टर, क्योंकि जैसा हमने पहले भी बात की है कि ओवर द काउंटर जो मेडिकेशन है वो हमें अवॉइड करना है, बिल्कुल भी नहीं करना है, स्पेशली इन द केस ऑफ एक्ने, बिकॉज उनमें स्टेरॉइड्स होते हैं, हमको नहीं पता कि उसको किस तरह से यूज करना है, हम करने लगते हैं अपनी स्किन पे और कई उसके साइड इफेक्ट्स हमको देखने को मिलते हैं। किस तरह के साइड इफेक्ट्स या बैड इफेक्ट्स, क्योंकि इनिशियली बहुत अच्छे रिजल्ट्स देखने को मिलते हैं, कई लोग कहते हैं कि बस हमने क्रीम लगाया और 1 महीने में मेरा चेहरा बिल्कुल चमकने लगा, लेकिन उसके बाद धीरे धीरे चीजें सामने आनी शुरू होती है। तो क्या क्या वो साइड इफेक्ट्स होते हैं, वो भी हम हमारे व्यूअर्स को बताना चाहेंगे।
So initially what will happen that the acne lesions वो जो होंगे वो थोड़े से subside हो जाएंगे. Then after prolonged use what happens, there is thinning of your facial skin. You'll have redness over your face. You'll have intolerance to heat and sun exposure. Then telangiectasia, that is visible blood vessels जो होते हैं आपके face पर दिखने लगते हैं, and there will be more severe acne. You'll have more severe acne. रोजेशिया एक स्किन कंडीशन होता है अपार्ट फ्रॉम एक्ने, वो डेवलप होने लगता है फेस पे. देन यू कैन हैव सर्टेन इन्फेक्शन, फंगल इन्फेक्शन ओवर फेस ड्यू टू स्टेरॉइड यूज, बिकॉज स्टेरॉइड आर इम्यूनोसप्रेसेंट. सो दीज आर सम इम्पोर्टेंट side effects of using steroid over face.
Okay, and doctor, before we wind up this session, any take home message for our viewers?
The most important message which I would like to give, that please don't self medicate yourself. Please do not follow the social media links. Please do not use the OTC preparation. Go to your dermatologist as soon as possible, because acne is not just a skin disorder. It not only leads to disfigurement of your face, it also has a very detrimental effect on on the psychology of the patient. We have seen patients with severe acne who have who go into depression, who have suicidal tendencies, who detach themselves from the surrounding. So acne is a disease which affects your physical appearance and your mental health also. So visit a qualified dermatologist as early as possible and prevent the sequelae of hyperpigmentation and scarring.
Right, and as soon as we could be able to diagnose the problem, the treatment would be really easy, and yeah, definitely. So it's important, essential to go and seek advice from the right person, which is a qualified dermatologist in case of anything related with skin. Thank you so very much, Dr. Swati Surabhi, for your valuable time, ma'am. It has been a very informative session for our viewers. Thank you.
Thank you so much.
It was great hearing you, and we really look forward for many more such sessions for our viewers with you in coming times.